My name is Niall Tamayo. I am a Master's of Nursing student at Athabasca University, and I'm supported by Dr. Annette. She's my thesis supervisor, and I'm doing a thesis. Hopefully, we'll do a thesis, and part of doing a thesis is doing a literature review, and my literature review is titled Effective Nursing Recovery-Oriented Interventions for Individuals with Substance Use Disorders. Disclosures, no disclosures. In terms of background, I'm currently a nurse educator at CAMH in Canada, in Toronto. I've worked in multiple psychiatric settings, but majority of my experience was in outpatient addiction setting. So why did I pursue this topic? So when I was working in the outpatient setting, individuals with substance use disorders started sharing their not so good experiences that they had when they were going to psychiatric units at other hospitals. And they spoke about their experiences also within our own hospital, one that specializes in mental health and addiction. They spoke about being treated differently, feeling stigmatized and discriminated against, and feeling like they're not human beings. And so I started thinking, what is it that I can do as a nurse, and what is it that nurses can do? How do we change this? And thus my research was born. So I'll briefly review substance use disorder and recovery in the Canadian context. In Canada, 1 out of 5, or 21.6% of Canadians met the criteria for a substance use disorder during their lifetime. So this means that there's a higher percentage that a care provider will come across someone who is struggling with substance use. 38.4 billion was the estimated overall health-related cost, loss of productivity, criminal justice, and other direct costs of substance use. So I think this was in 2014. 30% of this represented the total healthcare cost. So you can see there's a huge financial impact on Canadians. So although some individuals with substance use disorder can recover without some form of treatment or having no to minimal interaction with healthcare providers, there are some that come across care providers. And as care providers, we can discriminate and stigmatize, and nurses are not exempt from this. We can definitely show negative attitudes when working with these individuals, and these stigmatizing experiences lead to delay, avoidance in care, which further increases consequences and worsens these individuals' condition, which kind of creates a cycle of increasing cost and burden. So for those that we encounter in the system, we should have a standard of care. And as mental health clinicians, we can apply the concept of recovery. So I'm going to just talk about recovery. So looking at recovery is originated in the 1960s and 70s, and it used to be based on perspectives of professionals such as academics, lawyers, and psychiatrists. So it's based on their expertise, right? And in 2006, Kirby and Keon were Canadian senators that initiated a study regarding the mental health system in Canada. And the report contained about 2,000 personal stories that highlighted the deficits of the mental health care system. And it suggested that mental health services should adopt recovery-oriented practice. Looking at recovery, so we can have multiple definitions of recovery. So the first one is here. It's called clinical recovery. So when looking at this definition, it utilizes the expertise of mental health clinicians. And often there's a goal of restoring function, ensuring that there's long-term mental stability and that the person gets back to normal. There's a focus on diagnosing, treating, curing, and treating symptoms, which can lead to doing to the person rather than working with the person. However, as clinicians, we can have different or contradicting perspective on what normal is. Additionally, these individuals can also live with a diagnosis and presence of symptoms. So an alternative definition is one that's based on personal recovery. So personal recovery is a deeply personal, unique process. It's a way of living a satisfying, hopeful, and contributing life, even with the limitation caused by the illness. So it assumes, acknowledges that recovery is unique to the individual, and the person works towards it and is experienced by the person. It doesn't let the illness define the person, or it doesn't become a focus, but incorporates the experience. And so the focus becomes on wellness rather than cure, and the person becomes the expert rather than the clinician. So there can be applicable frameworks, guidelines, and theories that we can use for recovery. CHIME framework is one that summarizes the essential components of personal recovery. So it's outlined here. So it's connectedness, hope, identity, meaning, and empowerment. However, when they did this study, it excluded studies that define recovery from substance use disorders. Majority of the studies focused on severe mental illness, usually associated with mental disorders with psychotic features. And so this may or may not be suitable or applicable to when working with people with substance use disorders. In Canada, in 2015, we came out with guidelines for recovery-oriented practice. And so this was informed by a review of the literature, international guidelines, and best practices, and consultations over a 2-year period. And it really outlines how we as clinicians exemplify recovery principles. So there's multiple dimensions of recovery. So one is, for example, recovery is personal, and there's under each dimension, there's other things such as principles, values, knowledge, skills, and behaviors that talks about how you demonstrate recovery-oriented practice. Furthermore, the last one that we can use as nurses is the title model. And so this one specifies the nurse's role, function, caring responses, and applies the concept of personal recovery when working with people with mental health concerns. It came about when Barker and Buchanan Barker noticed that there was a focus on mental illness and disability rather than focusing on living. So under this theory, the nurse supposes that the person pursues recovery, and they are the expert and should direct their care. And if a person's utilizing the title model, they're guided by assumptions and commitments. And so that's how you know that someone is using the title model. So overall, there's diverse outlooks on recovery. And although we have these models, theories, and frameworks, it can take 17 years for evidence to reach clinical practice. Additionally, differing health system priorities can occur. And so there can be a gap between the ideal and actual practice. So overall, for my literature review, it was guided by the following questions. The two main questions in my head were, what were helpful nursing interventions, actions, and behaviors that promoted the recovery of people who are struggling with substance use disorders? And are there similarities and differences that exist between the perspective of nurses and individuals with substance use disorders? As a sub-question, I was also thinking about if people would speak about how the nursing intervention promoted the recovery. So I'm going to talk about the literature review. So on the left-hand side, you can see the search terms that I used, so interventions or actions or behaviors, and recovery, and substance use or addiction, and nurse. I limited the literature between 2010 and 2019. They had to be peer-reviewed and full text. And so this resulted in 10,480 articles, and I screened the title and abstract against the inclusion and exclusion criteria, removed duplicates, and that resulted in 51 articles. And I retrieved each one of them, and then again, I further reviewed the text against the inclusion, exclusion, and are they able to answer my questions. So in terms of inclusion, I really just focused on the nurses should have provided care to people who had substance use disorders. For people that have substance use disorder, they should have received care from nurses. It focused on adult population, and studies had to be in English. And lastly, the study should have examined an effective intervention, action, or behavior that promoted recovery. In terms of exclusion criteria, I didn't want to look at policy, population health interventions, or efficacy of treatment models and interventions. Studies also had to focus on substance use disorder. So if they focus on something else, I excluded that. I also excluded studies that only looked at factors that promote recovery and care expectations as well. So for the literature review, I applied thematic analysis and coding. So it was really emergent coding that I utilized. I didn't use a priori coding, but of course, I had those pre-existing theories in mind when coding. And so first assigning initial coding and then organizing and categorizing codes into subthemes and themes. So this resulted in the inclusion of 17 articles for the review. All of the studies were qualitative in nature, 3 were longitudinal, and 14 were done at one time point. In terms of the countries breakdown, 9 were done in Norway, 2 were done in Australia, 3 in Sweden, 2 in the US, and 1 in Canada. So the image on the left-hand side shows which participants were included in the study. 9 articles focused on individuals with substance use disorders. 3 articles had clinicians, which included nurses. 2 were solely nursing participants, and 3 included both individuals with substance use disorder and clinicians, which included nurses in their participants. The image on the right shows the diagnosis each article focused on. So 7 focused on substance use disorder, 4 had general psychiatry with substance use disorder embedded in them, and then 6 had concurrent disorder. So as a summary, the major themes that came out were person-centered care, empowerment, and maintaining supports and capability enhancements. So each major theme had some themes, sub-themes, and I'll talk about the next few parts. So under person-centered care, one sub-theme that came out was maintaining humanness of the person. And I'm going to give examples of what those mean. So it was helpful for nurses to create a welcoming environment. So for example, ensuring that the person had a bed, giving them beverage, or having warm clothing. It was also helpful to have a caring attitude or demonstrate a readiness to help. So nurses can communicate that maybe such individuals were in safe hands and they would receive help. It was helpful to be respectful and have empathetic responses. People also outlined that it was helpful to have personal belongings, so photographs, makes a person personable. It was also helpful to get to know the person and make sure that the diagnosis is secondary. And obviously, alongside this is we should be non-judgmental, so minimizing negative reaction, being mindful of body language. And then lastly, accepting that lapses or relapse or substance use can take place. So not just being abstinence-based. So alongside this is we want to make sure that recovery is individualized. And so this would mean that we want to uphold the person's recovery needs and goals. So it's important to extract their goal. So asking general questions to get their goal, and you want to co-create goals. So you want to help these individuals articulate smaller and attainable steps toward their goals. So SMART goal setting is an example. Sometimes we can also propose goals, and so it doesn't have to be focused on substance use. It can be based on nutrition, activity, rest, or hygiene as examples. We also need it to be accessible. So, for example, nurses should hopefully be available to speak. So, for example, at nighttime. And then lastly, it was important to let the person approach you when they're comfortable. So the next major theme was empowerment. And within empowerment, we want to focus on increasing the ability of individuals to make changes. And so the first one was collaboration and promotion of autonomy. So we want to promote active choice. So what nurses can do is, for example, discuss that they will be involved in the decision making. And then we want to make sure that we're not making the choice on their behalf. So a helpful intervention was to obtain the person's preferred course of action. Like, hey, so you have options A, B, C, D. Which one do you prefer to do? And sometimes people may not have a clue of what they're doing, right? Because this is the first time they're coming through here. So it was helpful to share ideas, information, maybe providing some psychoeducation, tools, resources, and advice. But you had to make sure that the person was open to this, right? And lastly, you want to be focused on building solutions. So asking about what previously worked, or what are some what do you think are some possible solutions to this issue? The next sub-theme was sustaining hope and future orientation. So it was important that nurses carried hopefulness and optimism that basically these individuals can achieve their recovery goals. And you want to convey hope to the person. So you want to outline basically that they have strengths as an example. And there are situations that people may give up. And so you as a nurse, we cannot let them, or you shouldn't give up. And so sometimes, for example, people may choose to or want to leave treatment. And so you can encourage the person to stay. You can also inquire about their aspirations. So this helps think about their future. And you can also invite them to daydream. So thinking about, what about the past? Some people, in terms of substance use, they have the past where they weren't using substances, right? And they can also envision a future where substance use is not present if that's their goal. And lastly, we also want to make sure that the individuals believe that they can achieve their goal. So similar to the strengths is you want to ensure that they're aware of the positive qualities. So give valuable positive feedback. And so within that, you want to remind them when they're down, as an example of what is going well, right? It's also helpful to summarize achievements. So what they learned, any accomplishments, any obstacles that they overcame. And so these were very helpful interventions. So all the studies outlined effective interventions ensure that individuals felt supported and had the necessary supports and had the ability to continue to tackle challenges in their journey. And the first support is the nurse, right? And so we had to ensure that we were listening and stimulated reflections. We wanted to first ensure that there's a safe environment, so addressing confidentiality and acknowledging the difficulty in talking about their struggles. We also had to ensure that we sense the right moment, so keeping conversation light and then moving on to serious topics. We want to allow the person to speak, clarify rather than criticize, and utilize reflections, focusing on their thoughts, feelings, and their coping. Second sub-theme was connecting and reconnecting. So again, outlining from before, we as clinicians, as nurses, have to be the support person. And so this was very apparent. So again, you can utilize the interventions from listening and stimulating reflections. Both nurses and individuals outlined that the nurse should maintain contact. And so other people outlined, for example, that if they can't make it to their appointments, we visited them in the community, as an example. Reestablish familial connections. It's important to ask them if those relationships are vital and is that something that they want. So if that is something that they want, we can involve family members in care planning. And lastly, there are people who may have lost friends and families, right? So it's important to increase their social supports so we can connect them to peers. So an example is through group programming, rec, and therapeutic groups as well. Lastly, it was also helpful to perform activities to improve their ability to deal with practical everyday problems. So co-navigation, so there's multiple systems, so we can connect with other clinicians, other programs, or an example is a social service system. We can also support creating or re-establishing routine, so accompanying the person to shop for groceries, cooking, cleaning, arranging housing, rent, and payment. If there are opportunities and activities, make sure that they are aware about it. So, for example, vocational courses. There are also valued skills that the person thinks about, such as conflict resolution skills and assertive communication. So making sure that we support them with that. So the literature review concurrently examines the perspectives of individuals with substance use disorder and nurses' perspectives regarding beneficial interventions that promoted recovery. And so I think that it's the first literature review focused on nursing. And overall, a lot of the interventions overlap with CHIME framework. They coincide with the guidelines for recovery-oriented practice. And then the assumptions and commitments of title model is very apparent. In terms of both perspectives, these are the following sub-themes and interventions that were voiced from both perspectives. So, for example, maintaining the humanness of person, collaboration, promotion of autonomy, sustaining hope and future orientation, listening and stimulating reflections, and skill acquisition. So this finding is an indication that maybe the interventions offer the most benefit and should be prioritized. There's also, based on the study, there's sub-themes that or interventions that resonated or only came from individuals with substance use disorder. So, for example, connecting and reconnecting, even in one study, for example, that included both nurses and individuals with substance use disorder, reconnecting only came from the perspective of individuals with substance use disorder. And then system navigation, do we see this as a routine intervention? Because we do this often, right? So maybe we don't mention it, but we do it. And then providing, receiving information. So this may highlight the perceived need of individuals to be involved in the care planning process and making sure that they have the information. So we need to be attentive to these specific interventions because we might be underutilizing them or maybe even undervaluing. And so maybe potentially this decreases the effectiveness of the care we provide. From the nursing perspective, there was being accessible and being strengths-based as what came out as more apparent from the nursing perspective. There was also those that were rarely mentioned. And so again, this is coming from experience and the literature. So for example, withdrawal management was only mentioned in 2 studies. However, this is a required competency when we care for people with substance use disorder, right? And spirituality, these were seldom mentioned, but we promote this a lot. So for example, AA, NA, we push for those. Culture was only mentioned in a study completed by Monroe. So that was very interesting. Self-disclosure. So there was this discussion about photographs, right? But self-disclosure of experiences with substance use or substance use history. Although our nursing college discourages disclosure, people that have substance use disorder say like it's helpful to hear that nurses had lived experience because it promotes the possibility that recovery is possible and increases my hope. Advocacy as well. Maybe for people, we don't mention it as nurses because we do it continuously, or even people that have substance use disorder, maybe they don't see us do that. And one thing that I didn't see was harm reduction, and so harm reduction has come a long way here in Canada, in Toronto specifically as well, and so that I was shocked not to see that as well. So there may be unapplied, underutilized, effective recovery facilitating interventions. So as a takeaway, it's really helpful to be familiar with the models, theories, and frameworks regarding recovery. We should apply those that are outlined as effective. And sometimes we may overlook certain interventions. So for example, those based on the individual with substance use disorders. And so we could also consider application of rarely mentioned interventions. So for future directions, so looking back to my experience, this topic was important to me because it looks at how we as nurses provide effective care to individuals with substance use disorders. And so this knowledge can support and improve care. And many of the interventions were ones that I used, right? And so overall, only one study was based in Canada, so it would be helpful to do a Canadian-based study. Only 3 out of the 17 studies focus exclusively on nursing. And so it would be helpful to also explore the nursing perspective as a focus. It would be helpful to also explore if a recovery-oriented intervention enacted by a nurse was generally beneficial for that individual. So another study would be one to include both nursing and individuals with substance use disorder and look at a longitudinal study. And then depending on the settings, some interventions such as performing house visits and having personal belongings, that may be inapplicable to inpatient settings, but in outpatients they do. So it might be helpful to consider another study that includes multiple settings. So overall, it's really important to know what are effective, and as care providers and a recipient of care, we can have varying perspectives. It's important to move beyond the theoretical aspect and apply the models and theories that we learn or find out. And really, if we do more of the things that are effective, we will improve healthcare and improve outcomes. Thank you so much. And if there are any questions, I can answer them.